Well, good afternoon. Lee Harris, Mayor of Shelby County, and pleased to be here on behalf of the Joint Task Force. Today, of course, is Election Day, and we are pleased that so many Shelby Countyans have already turned out to vote. We've had in this county more than 300,000 residents that have voted early. And in addition to that, we have more than 25,000 residents that have voted absentee ballots. So we are really pleased to see a huge increase in the votes that have already been cast in Shelby County, a huge increase when compared to 2016. Because of the huge turnout, Shelby County has seen more votes cast than any other county in the state of Tennessee. In fact, 1 in 7 votes cast in our state are cast right here in Shelby County. So we've seen more votes than we've seen in decades here in Shelby County, and we would encourage everyone to take advantage of today, if they haven't voted, and to turn out and make sure you cast your vote. And I'm here to just remind everyone that you're able to cast your vote safely. We know the Shelby County Election Commission has done a great job of making sure that the polls are very safe, and we would encourage everyone to take advantage and get out to vote. One of the things that you might do, just as by way of tip, if you are going to turn out to vote, reduce the hassle by checking your registration and your polling precinct location before you leave your house. You can go to the Secretary of State's website, which is govotetn.gov. Again, that's govotetn, the abbreviation for Tennessee.gov. And there at govotetn.gov, you'll be able to quickly check your voter registration status to make sure that everything checks out, and you'll be able to locate your polling precinct for today, Election Day. I did it this morning, and it took me about 5 seconds to check my voter registration and to identify my precinct. Make sure you get to the polls safely. Just a reminder that MATA is providing free rides all day today. So MATA provides free rides all day today. So if you need a ride to the polls, feel free to hop on a bus. And that also can be done relatively safely. MATA has required masks on their buses and also has instituted occupancy limits on those buses. Take what you need to the polls. The Election Commission has done a great job of making sure that all the items that you'll touch are disposable, and so that no voter has to touch something that another voter has already touched. But every once in a while, in rare instances, those supplies could run low or maybe even run out. So as you head to the polls, make sure you take a pen, make sure you take sanitizer, and make sure you take a tissue with you. At the same time, we always want to make sure we take a mask, and don't take it in your pocket. Wear it over your nose and over your mouth the entire time you're at the polls. And where possible, try to social distance while you're at the polls. When you get to the polls, make sure you have your ID ready. That also reduces some of the hassle and some of the wait time you might have when you are there to exercise your right to vote. So with that, I would encourage everyone to vote, and I would be pleased to see Shelby County as one of the highest turnout counties in the state of Tennessee when this is all tallied up. At this time, I'd like to invite to the podium David Sweat, who is leading our COVID response team.
Thank you, Mayor. So just to give you an update on where we are in terms of our numbers, as of today, we've had 38,352 cases of COVID-19 disease diagnosed in Shelby County, and we had 399 new cases reported yesterday, from yesterday today, and 574 fatalities, with 1 new death in the last 24 hours. As far as testing goes here in Shelby County, we've had 562,963 tests that have been performed. And in the state of Tennessee, so far we've diagnosed 264,587 cases as of 2 o'clock yesterday afternoon. In the area surrounding us, Tipton County has reported 2,565 cases. DeSoto County in Mississippi, 7,632 cases. And Crittenden County in Arkansas has had 2,454 cases reported so far in the epidemic. So with that, I'll also mention that one of the things that we continue to watch are the clusters and places where there could be transmission that affects vulnerable populations. It's a thing that we've been monitoring throughout the epidemic and providing technical assistance to our long-term care facilities, whether they're nursing homes, assisted living facilities, or what have you. At the moment, we have 16 active clusters in Shelby County long-term care facilities, and we continue to provide technical assistance to each of them. With that, I'm going to turn it over to Director Haushalter for further comments.
Thank you, David, and thank you, Mayor. Good afternoon, everyone. Just wanted to add a few comments, then I'm going to turn it over to Dr. Randolph, who's going to speak very specifically to the faith community. If you consider the numbers, we are still in a very difficult time. I said last week, the numbers really foreshadow a challenging fall, and the upcoming weeks are of very significant time for us as a community. I do fundamentally believe we can get through this together, but it's critical that we do what each and every one of us can do individually and collectively to reduce the impact of COVID on ourselves, our family, and our community at large. Each of you knows our typical mantra as we talk about masking, social distancing, and so on. So today what I really want to focus on is what we're seeing relative to people who are symptomatic. We do know that almost 80% of individuals are symptomatic and have some level of symptoms. One of the things that individuals experience is a slow onset of symptoms, maybe some early sign of a cold or flu that then over a day or so becomes a loss of taste or smell. We know of the people who are symptomatic, they continue to engage in their activities of daily living, including going to work, socializing with others, and so on. So the key takeaway today is to be very attentive to your own health and well-being. Do what you can to remain healthy. That means take the flu shot. It also means assuring that you're taking any medications you need to if you have a chronic illness, seeing your health care provider, eating well, and getting sufficient rest. But as soon as you have any signs and symptoms of illness, that could be anything from the sniffles to a mild fever, please stay at home, avoid contact with others, get tested as quickly as possible, and then based on the test results, make decisions accordingly. Also, as we move into the holiday season, we'll be providing more guidance on things that individuals can do around the Thanksgiving holiday to assure that they're safe and their family is safe. Again, I believe that we can get through this together, but it is important that we rally around and stay focused on the upcoming months and stay diligent about reducing transmission in our community specifically. So I'm going to turn it over to Dr. Randolph for updates specifically to the faith community.
Thank you, Dr. Haushalter, Mayor Harris. Greetings, fellow citizens of Shelby County. Bruce Randolph, the health officer for the health department. I'd like to just spend a few moments reaching out to the faith community, the faith leaders, churches, places of worship. As you well know, that we are approaching Thanksgiving and would soon be entering into December, the month where we celebrate numerous religious holidays. And we also recognize that as leaders, that you are very influential, and so therefore we are reaching out to you and asking that you partner with us to help us in getting out the following messages. And one is the importance of wearing the mask, and continue to wear the facial mask, because that is what is going to allow us still to be able to go and do things. But also we're asking that you help us remind people to social distance. We need to separate 6 feet or more, and to stay home if you are sick or ill, whether that is work, and if you're having in-person worship services, encourage your church members to stay home if they're having any symptoms, if they are ill. God hears our prayers wherever we are. We can worship Him in our home, virtually as well as in person. So we ask that you do that. And also help pass the message on about hand washing and sanitizing, limiting crowds, and also testing. It's very important that we encourage our members, if you are having some symptoms, if you've been around someone, if you want the assurance of knowing that, you know what, I'm not an asymptomatic person who's infected, we encourage you to go get tested. The other thing is that we want to let you know that we are available. We have a new project. Dr. Jane and myself are available to participate in virtual as well as in-person meetings to provide information to you, your congregations, your members, also to provide technical assistance to you if you're contemplating or thinking about reopening. I've visited several churches to provide technical assistance, understanding that, you know, we do not govern places of worship, but we are here to be a resource for you. Last thing I want to do is to just even thank you, the faith community, for your participation at this point. I've been very impressed with those places of worship that I have visited, that you are doing the right things. You are emphasizing the social distancing and wearing the mask and the hand sanitizing, and I want to encourage you to continue. Lastly, I want to just ask that you help us in the event that you do have a case. It's very important that you notify us if you know of a church member or someone in your congregation who tests positive, and to assist us in identifying other people who may be contacts to the case. So we want to thank you for your participation to this point. We want to encourage and ask that you continue. We're going into a very challenging time of the year with fall and winter, and so we're going to need everyone to participate and do their part. With that, I will stop and entertain any questions that you may have.
Jane Roberts, Daily Memphian. Jane, I think you might be self-muted. Go to Michaela Watts, Commercial Appeal.
Yes, good afternoon. Since we're talking about churches and the faith community, I wanted to check in and see if in the process of contact tracing, if church attendance is something that frequently comes across.
I'm going to let Mr. Sweat answer that.
Yes, thank you for the question. When we did our analysis last week of over 700 interviews, we did see that for those individuals who had symptoms and those who had tested positive, when we looked at their activities that they engaged in while infectious and while symptomatic, we did see about 9% of people, 8 or 9%, reported that they had participated in worship, attended places of worship during their infectious period. So yes, that would be one of the categories that Dr. Haushalter talked about, that what we see in the data, from the interview data, is even though people have symptoms, they're engaged in their normal activities of daily living or living their life more or less normally too often. And so 65% of people report being out and about. and only about a third or so report isolating according to best practices.
Great, thank you. And I just have a quick follow-up question about hospital capacity. I think this has been asked before some weeks ago, but it's probably worth asking again. What are we to make of our hospitalization numbers? We've volleyed back and forth between 88%, 92% at times of acute and intensive care rooms. Is this a normal level of capacity? Would we have seen the same capacity pre-pandemic?
No, it is excessive. It is excessive. When we analyzed our data looking earlier this year at pre-pandemic utilization of things like our intensive care unit versus current, we definitely did not see, in other words, there was about 85% hospital utilization pre-pandemic, but we're routinely above that, and certainly in the intensive care units, we are much above what was normal or would be normal without the COVID-19 epidemic. Now, there is a concern we have heading into November, December, January, and that is influenza. Because one of the things that we do experience on a regular basis, a seasonal basis, is strain on the healthcare system due to the annual influenza epidemic. And we still have very low levels at the moment of influenza activity, but we know that heading into Thanksgiving, Thanksgiving really is the great mixing bowl holiday for America. And you see people traveling long distances, getting together with people that they have not seen each other in a while. It's a great opportunity to shed virus and share virus with different people. So every year we see that influenza activity really gets energized by holiday gatherings like that and the travel associated with it. And we, on a very frequent basis, we see lots of people showing up in the emergency departments, and some of those folks winding up being hospitalized and also placed in intensive care due to the influenza epidemic. But when you have that happening at the same time we're already stressed to COVID-19, that's really one of the things we worry about. And it's also one of the reasons that we advocate and have been advocating for weeks that people need to go get a flu shot. It's still not too late. There's very low levels of flu activity in our community. It takes a couple of weeks for the flu shot to give you immunity, but we definitely encourage people to go get that.
David, may I add something to you?
Absolutely.
I just wanted to add to David's comments, really talking specifically about staffing. In the early phase of the pandemic, I noted that nationwide we have a nursing shortage. And at that time, we had hot spots throughout the country where we had cases of COVID. We now have COVID widespread across the country. We do know that healthcare systems and healthcare providers, including nurses, are impacted by COVID infection as well as potentially flu, which will make nursing shortages more problematic as we get into the fall. We don't have the ability. New York was able to recruit nurses from all over the country. There will be less ability to recruit nurses into key areas when the hospitals reach capacity, and then if nurses are ill, either with the flu or COVID, it's going to cause additional problems. So reducing the community spread is what's most important at the current time.
We'll go back to Jane Roberts, Daily Memphian.
Looks like testing, based on today's numbers, was up considerably. Could you comment on that, please?
Well, obviously we keep pushing testing, so I do believe people are getting the message that they should get tested whether they have symptoms or not. There's plenty of testing capacity to use it, but we also know with our numbers going up and a good portion of people who are infected being symptomatic, people are seeking testing because they do have signs and symptoms as well. And your follow-up, Jane?
That's all I have. Thanks.
Thank you.
Looks like those are all of our questions for today. Any closing messages?
Just want to encourage everyone to get out and vote if they haven't already done so. Thank you.
Thanks, everyone. We'll see you back here on Thursday.